Madam Chair, we have enough grants committee members that are now on the call to establish a quorum.
Okay, we will go ahead and call the meeting to order. My name is Sarah Thomason. I serve as Vice Chair of the Opioid Abatement Authority and Chair of the Grants Committee. And it looks like I see the following members in attendance. I see Senator Pillion, Delegate Sewell, Sharon Buckman, let's see, Dr. Jimmy Thompson. Is that it? As far as you can see?
Sharon Buckman.
Yeah, I said her.
Yep.
I don't see Mr. Spencer, Mr. Holland, or Mr. Tillum. Are those the three?
That's correct.
Okay. Hopefully they will join us. We'll go ahead and keep moving on since we do have a quorum. I want to make a special welcome to Delegate Brianna Sewell, who has been appointed by our board chair, Senator Pillion, as an official member of our grants committee. So we're so glad she's with us. Additionally, I want to welcome all of our OAA staff and any other guests that have joined our meeting. Glad you are with us. First item, second item on our agenda is the approval of our minutes from the November 9th, 2024 meeting of our grants committee. Do I hear a motion to approve these minutes that were posted on our website?
I will so move.
Thank you, Dr. Thompson. Do I have a second?
Second.
Thank you, Mrs. Buckman. All in favor, please say aye.
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 Any opposed? All right. Minutes are approved. Moving along, the next item is for our committee to receive an update from the Director of Operations, Mr. Charlie Linticum.
Thank you, Madam Chair. Afternoon, everybody. So first, I'm going to give you a couple of just quick updates on city and county and state agency grant activities for the FY25 awards that were initially approved back in May. 68% of them have returned their award packages, and funds have been or very soon will be transmitted to them. 32% have outstanding documentation requirements. This happens a lot with newer projects, especially newer cooperative projects where the localities are hammering out the legal framework and the operational agreement that's required for them. So, but our regional abatement coordinators are staying in contact and providing support where needed. All of our city and county annual reports have been received. 60% are in the compliant level and 40% require some follow-up, which we'll be working on starting next week. We do have three kind of final grades: compliant, which means everything's going the way we expect; substantially compliant, which means maybe there's a couple of small items that need to be corrected over the next year, but nothing that is really affecting, you know, the scope and the terms and conditions, that type of things; or non-compliant, which means things are not being done as stated or outside of the terms and conditions or requirements of the grant. So I think we believe once we work through, everybody gets some more questions, everyone should move up into one of the top two categories for being finalized. There's planning grants, which we have a progress report due from all of those active planning grants on December 12th. This includes the ones that were awarded in fiscal year 24, which were 2-year awards, and ones that were awarded about this time last year in FY25 that were 1-year awards. These reports may result in some amendments for the committee to consider at the next grants committee meeting on February 21st. Update on state agency awards. All the MOUs for the awards that were approved in August have been sent or are in final revisions. 31% have actually been signed, come back, and we're starting now the appropriation transfer process next week. 25% have some amendments that you all will be considering today, and if approved, will be incorporated and sent off. And 44% are in a back and forth process between OAA and the receiving agency, finalizing some details. So some of these, there are a few of these, as they have gotten into their projects, may result in some small amendments for the committee to consider in the future. State agency carry forwards. There's a few amendments. All the reports have been received, but there are a few amendments that we'll be considering today related to that. And there's one agency that we're working with to get documentation from their leadership that's needed to put an amendment before you all, which will be handled at our next meeting. And their annual reports are due December 9th. And we did a webinar on how those were to be completed and posted that on the website. And then soon, before you know it, we'll be into the next proposal window for them. And I'll provide updated information on that at the February 21st meeting. So first slate of items to look at today are amendments to state agency awards. And these all came from the carry forward, we call carry forward true up, which is when their proposal is presented is before the end of their performance period. And so once the carry forward they may have from one year to the next is an estimate. So then once their performance year has ended, we do a kind of a level set true up process, and that tells us where do they end up and helps us determine do they need to come forth for an amendment to get themselves right sized. You can see here there's standard conditions for all of them. One-time use, can't expand the project beyond the grant scope. Approval does not obligate the OAA to approve increased amounts. Carry forward must, if they have a lot of carry forward, they have to demonstrate that 80% of it is encumbered before we will transfer the next year's worth of funds. And everything that was approved initially for these projects still applies on any of these carry forward amendments. So we have a couple of quick ones. We have one for the Department of Corrections. They had more funds at the end of the year than they originally anticipated, and what they would like to do is request to reduce their performance period 24-25 amount by that amount, which is $118,750. And so they'll carry those funds forward and keep working on that project. That was due to some startup time frame to get these MOUD social workers on and integrated into their processes and whatnot. The next is the Virginia Department of Health's naloxone distribution program. So as a reminder, there's two naloxone related projects with the Virginia Department of Health. One is a naloxone purchase program, which they were awarded in 23-24. They had some carry forward left over, so we just extended their performance period and expect them to expend all of that in this period. This is the distribution program is basically providing infrastructure for VDH and its pharmacy team to be able to receive requests from different groups and be able to kind of mail order, send out naloxone to people. So what they want to do with the funding was generated due to some timing issues, some lower than expected demand, and so a few things like that. They would like to use this money as for a one-time expense to develop an at-cost model for portal for where organizations can request naloxone. So last year they had some money from OD2A, known as Overdose to Actions, where they developed the no cost request process, and they want to kind of build upon that, but they have to add some additional processes for displaying price and doing invoicing and making sure people are paying their invoices and things like that. So that's what they want to use these funds for. So it'll be a more streamlined process for groups that maybe don't qualify for free, no cost naloxone to be able to request the at cost naloxone through VDH.
Madam Chair.
Yes, Senator Pillion.
Hey, Madam Chair, question for Charlie. Did you say that they had a lower than expected request for naloxone?
Not for naloxone. This distribution program did not include the what's the word I'm looking for here? Did not include naloxone distribution, but there were some test strips like fentanyl and xylazine test strips that can be packaged with and sent out as well. There was lower demand for those. As far as the naloxone purchase process, I don't believe it was a lower demand. I believe it was a lower cost than was initially anticipated for the demand, which is why that separate project, which was addressed with carry forward at at our previous meeting. That's why that performance period was extended.
Okay, thank you, Madam Chair.
So apologize if I put the wrong word in front of the wrong word there.
No,
David.
no, I'm sure you said it correctly. I just want to make sure that I didn't hear, because I know there have been plenty of people that have been requesting a lock zone. So I just want to make
100%.
sure that they're,
100% with you. All right, so on to the next piece, Virginia Department of Health. This is their substance use disorder coordinators, which are in 3 urban health districts. And these positions basically consolidate all the different pieces of substance use disorder projects and services that health departments offer, and provide leadership throughout the community and within the departments to get those executed. They had a little more money at the end of the year than they originally projected. And much like the DOC project, they just want to have their current year, their 24-25 award reduced by that like amount by $52,000 to account for that. So that's for these two, there's just a little bit less money of ours going out the door this year. They're carrying forward money to continue to do what they have been set up to do, but that will be a little bit more money that we can put in the pot for future years. University of Virginia Street Medicine Access and Reduction and Treatment, which they call their SMART Clinic. There's just their carry forward is higher than expected due to some timing issues related to purchasing supplies and some other items. So they're requesting to carry this money forward as to within the approved scope, because there are just some items that did not get bought in the first performance period. So the expenses and the funds are being carried forward here. And the last one is the VCU, the toolkit for localities, had a little more money than expected. And what they'd like to use this for is to develop a series of quarterly meetings and outreach sessions to allow community members and right center faculty and experts to share insights, disseminate knowledge and best practices. They'll make sure those sessions are recorded and available through the toolkit website, and possibly future sessions may increase to a monthly availability. So this is a kind of a modification, kind of an addition to scope for them, because doing outreach to communities is part of the scope of this. But because we're adding this kind of regular meeting component, this is not obligating us to increase their funding for year 3 for renewal. This is just one-time usage of these funds, and we'll see what the results are. So from state agency awards, I guess any questions on the state agency recommendations before I move forward? Okay. Hearing none. City and county award amendment recommendations, we just have one. So Chesterfield County has their cooperative partnership for mobile outreach, harm reduction, treatment, and support. The amendment that's being requested is just to change the source of Powhatan County's matching funds from their direct distribution to their individual distribution. It only impacts that source, and all other terms, conditions, requirements, and contingencies are still in place. The amount, so basically what this is doing is authorizing an individual distribution grant of $22,781, and then Powhatan will reduce its direct distribution match by the like amount. So just kind of a right sizing. This is similar to an amendment we had at our September meeting for a cooperative project. And now on to new city and county individual distribution applications and recommendations. I am happy to say this is the first set of applications that have come through our grants portal. And a lot of the work that's been put in there did make it easier, both for us to review information and to communicate back and forth with the applicant cities and counties, and also for them to make adjustments and resend things to us. So I'm excited as we go forward and continue to refine this process, some efficiencies and actually some speed of process that the system is going to bring. So first, Virginia Beach has requested 6 projects with combinations of individual distribution and gold standard funds totaling $636,105. The first program that they have is their youth peer support and prevention and outreach for $203,500. This will train a youth peer support specialist to provide SUD and abatement services throughout the city of Virginia Beach. They're going to be trained as a certified peer support specialist and provide youth peer support in offices, communities, schools, juvenile detention center, and any other areas. There's all the work that they'll be doing is going to be based on the evidence-based strategies preventing opioid overdoses from the CDC. Services will be provided with a combination of individualized support, co-facilitations with licensed mental health practitioners, development of a volunteer peer support program for youth, and engagement in community support and educational activities. The services will be part of a person-centered, family-driven process, including goals of youth peer support and an individualized plan of service, and will be mutually identified in active collaboration with the youth receiving services. They'll also begin to identify and develop a youth coalition to provide volunteer peer support for other youth in the city. Additionally, the funding will be used for the purchase of a vehicle specifically for the peer to get a move around the city, and a prevention van for activities for outreach throughout the community for different types of opioid education and prevention at local events. The next project is opioid services at the Juvenile Detention Center. This is $75,000. Intends to provide opioid awareness, education, prevention, and treatment to residents in the predispositional and or post-dispositional programs at the Virginia Beach Juvenile Detention Center. They're going to contract with an agency to provide licensed substance abuse counselors to support the continuum of prevention, harm reduction, and recovery supports for a population of vulnerable youth. That's going to be based on the National Commission for Correctional Health Care and Opioid Use Disorder Treatment in Correctional Settings documents. Internally, the project will be overseen by their clinical services coordinator, who will collaborate with the contracted providers to manage the implementation and scheduling. The Juvenile Detention Center staff will also receive training and education to increase knowledge about opioid use skills for working with adolescents who are at risk or have substance use and substance misuse disorders. And additionally, there's going to be biopsychological needs assessments, individual and group therapy, and providing parent psychoeducation groups within the population. And the idea is to tailor these processes to the individual youth and their needs. Next project, Virginia Beach Police LEAD program and community outreach. So LEAD stands for Law Enforcement Against Drugs program, which has received multiple evidence-based endorsements. This will be both done with Virginia Beach Police Department in cooperation with Virginia Beach Schools and an after-school community education setting. It's a 10-week evidence-based tested K-12 curriculum delivered by school resource officers who are trained to teach this within a school setting. And it's addressing drugs, bullying, and violence. The curricula is based on the 10-week Too Good for Drugs curricula, which has been a proven effective information for all drugs, including opioids. The instructors will create safer, healthier communities and are a major source of distribution and providing naloxone on the street. There will also be an on-the-street officer education certification program, and there will be a vehicle and trailer purchased by the Virginia Beach Police Department's Youth Services Unit for community events as a way to provide drug education resources to youth and other members of the communities, including training on proper use of Narcan. And they will also develop a mascot you can use to engage younger children at community events. Next project is Virginia Beach City Public Schools. Online substance use and wellness interventions. They're going to be partnering with a company called Third Millennium Classrooms to provide online evidence-based programs for student intervention education. And a number of this Third Millennium's programs are developed from multiple evidence-based sources. One of the features that makes their interventions unique is there's a kind of a hyper personalized user experience. Students receive a My Summary personalized feedback report immediately upon completion that includes behaviors and risk factors. It's a confidential report, but can be shared at the discretion of the student. It also includes integrations which draw on motivational interviewing and social norms theory to motivate students to reduce their consumption based on personalized feedback on, substance use risk factors. The public schools are going to target secondary students for this, and we've been implementing immediately for first and second time offenders of the student conduct of code for substances and behaviors. Staff will have access to the student management system and can track their status online. And then some of the data that we'll be able to collect will be used during conferences with students and their families on the back end about how the interventions are working. Next is the Teen to Teen social media campaign and outreach initiative, 132,000. It's going to focus on stigma reduction, harm reduction, and treatment avenues, and not scare tactics, to engage Virginia Beach youth in meaningful consideration and education of substance use, in particular fentanyl poisoning. This is going to be based on a couple of peer-to-peer related social media documents as effective prevention and social media as effective public health strategies developed by, based from the National Institute of Health and from a group called COSUP, which is the Comprehensive Opioid Stimulant and Substance Use Program. Social media campaign will be combined with outreach efforts that are going to employ 2 highly qualified community health workers and create a youth ambassador influencers program. They're going to engage with an experienced marketing and branding firm to help with some of the social media campaign details. They'll work with teens and people with lived experiences to provide providers and community leaders to kind of curate relevant messaging for these platforms. They're also based off the success of a program called Living the Example, developed by Mentor USA. The CHWs will launch a similar program to this in Virginia Beach, which is a 6-part series of group ambassador trainings conducted by the community health workers. And that'll develop social media content in partnership with and informed by the marketing firm. And the ambassadors will develop a calendar of activities and projects to continue the outreach and engagement throughout the year. Then the community health workers will provide support and counsel to the teen ambassadors. And the last program for Virginia Beach, which is really pulling a lot of things together here, is their Parks and Recreation. This is not about drugs program. There'll be the Parks and Rec staff will be trained and implemented on the program, which is based on SAMHSA's opioid overdose reduction continuum of care. It'll be this is the staff within the recreation centers at Virginia Beach. Program is created by a company called Overdose Lifeline. It's youth focused, addressing substance abuse with special emphasis on prescription opioids. Program targets youth grades 6 through 12. Each session consists of a pre-assessment, 45-minute film and discussion, and a post-assessment and after-lesson takeaways and support. In addition to the youth curriculum, there's also companion parent, community educator programs that cover a wide variety of opioid abatement subjects. So now down to Warren County. This is a individual distribution project, 72,850. This is their Raymond E. Santmeyer Student Union and Activity Center. So this student union program is an enhancement to their existing Reaching Out Now program, which has been in existence for 5 years and primarily focused on one high school in Warren County. The existing Reaching Out Now program focuses on leadership development, youth empowerment, and service to the community. Expanding to this student union program will create a comprehensive, structured after-school program offering a variety of evidence-based substance abuse prevention education based on the SAMHSA Guide for Prevention, as well as social skills, life skills, and behavioral health supports. All student members will be required to participate in at least one substance abuse education program per semester. The student union is going to provide tutoring and workforce preparation. The expansion is going to now include all youth in Warren County between ages 13 to 18 and grades 8 to 12. The student union will also be a hub for other substance abuse prevention and abatement activities, including teen recovery meetings, family engagement programs, and prescription drug take-back days that were going to be scheduled just before extended school breaks to try and remove some of these prescription drugs from the homes before the kids may be in there in a more unsupervised fashion. And lastly, for individuals, this Lynchburg City. This is Roads to Recovery Withdrawal Management Program. So Roads to Recovery is a nonprofit recovery group in the Lynchburg area. And this withdrawal management program will provide care, support, and connection to ongoing treatment and recovery services for up to 417 adults each year experiencing withdrawal from opioid and other substance use disorders in Central Virginia, which includes Lynchburg, Amherst, Appomattox, Bedford, and Campbell counties. The population focus will include under-resourced individuals who do not have safe, drug-free places to begin their recovery. It's an 8-bed program emphasizing evidence-based peer and social supports for delivery of detox services and safe and supportive environment, including wraparound supports for seamless transition into treatments and other recovery services and other community services, assisting and achieving sustained recovery. This program will complement and collaborate with the Horizon Behavioral Health Crisis Receiving Center, which currently is funded in part by an OAA cooperative grant with Lynchburg and Campbell County. It's going to be a step down level of care to ASAM level 3.2 withdrawal management from Horizon's medical detox program. The Roads to Recovery program also includes a specialized structured environment for individuals experiencing opioid and other substance withdrawals sufficient to require 24-hour support, but not to the level of a hospital facility. So any questions on city and county amendment or new applications?
I've got a question, Charlie, about
Yes.
the last proposal, the Roads to Recovery Withdrawal Management Program. Is there any limitation on who qualifies to receive the scholarship for participation in the detox program? Do they have to be part of any particular referring program? Can they be referred by any medical service? Can they self-refer?
Cindy, do you have some information you can provide on that?
Charlie, I didn't see anything in the application about that. I'm not sure if I understand what he means about scholarship. I know they're going to be just that step down for that next level of care. They're not going to bill for any type of facility services like treatment services. They're just going to be providing the peer support, which, is billable, and also just any connections to counseling and other services they might need to kind of get them on to whatever path they need to be on recovery. I don't know if anybody from that group's on the call. I don't think there's any limitations outside of the group that you named for the service area that they serve.
Yeah. I think based on our conversations, they'd be focused on residents in that area and people coming through the Horizon Behavioral Health, but it did not sound like they were limited to that necessarily, because there certainly are other areas of the state and other adjoining counties that might be the best fit for them. Any other questions? All right. Moving on to the last section of this update. So based on, this is going to be to discuss the overview of the proposed new grant opportunity called Operation Stop. This is based on a kind of a motion made by Senator Pillion at our board meeting last month to create a specialized grant program that has to do with focusing on a particular population that is having a larger adverse impact from opioid overdoses than the rest of the state. So why are we putting this opportunity together? National and state data show a decline in fatal opioid overdoses in 23 and 24. But during that time, the crisis itself has evolved. The overdoses have shifted from overprescribing and misuse of opioids to now involve fentanyl frequently mixed with stimulants such as cocaine and methamphetamines. The shift has concentrated opioid overdoses in urban areas, whereas the overprescribing was more concentrated in rural areas. Data from the Virginia Department of Health shows a 59% increase in opioid overdose deaths per 100,000 persons statewide from 2019 to 2023. Disparities when comparing rates amongst racial groups during the same time period show the overdose death rate increased for white Virginians at 11%, but for Black Virginians at 41%. This trend also aligns with national patterns, including KFF News analysis showing national drug overdose rates among Black individuals surpassing those of white individuals, 47.5 per 100,000 for Black, over 36.5 per 100,000 for white. And the National Institute on Drug Abuse has highlighted that between 2015 and 2023, overdose deaths among non-Hispanic Black men 55 and older increased nearly fivefold. And in 2023, deaths in this group were nearly triple the national average for their age demographic, with fentanyl and cocaine as predominant contributors. So, with that issue known, what does this grant opportunity provide? The grant opportunity provide the OAA to make awards of up to $500,000 per grant, with a maximum total of all Operation Stop awards to not exceed $3 million. Operation Stop grants are competitive and only available to individual cities and counties that are listed and identified in our guidance, and I'll explain more about that as I go. And the evaluation criteria is established by the Code of Virginia the same way as all OAA grants. Awarded funds would be available with the initial performance period of July 1, 25 through June 30th, 26, or fiscal year 26. Awarded cities and counties will have an option to request a renewal or extension of the performance period into fiscal year 27 and carry forward any balances if necessary. This is a single award with a maximum of 2 performance periods. The primary focus of Operation Stop is for cities and counties to implement an immediate short-term education prevention program to reduce overdoses and deaths, while assisting the community in development of a strategy to use other opioid settlement funds for long-term opioid abatement projects. So what are the requirements? Operation Stop grant applications have to reference data and how it's going to be used in implementing these efforts, with kind of common sources of data being things like OD map, overdose mapping process system. Applicants must partner with at least one community-based organization that has a track record of success in connecting with and successfully serving the specific population that's at highest risk of overdose within the community. The Operation Stop grant application narrative must address how the cities and counties will specifically accomplish 4 objectives using traditional outreach and education methods. 1 will be identifying residents at the highest risk of overdose, and specifically those who may be difficult to reach using traditional outreach and education methods. 2, develop and implement a targeted outreach and communication strategy for high-risk individuals. 3, implement and expand harm reduction efforts targeting targeting the identified high-risk population. And 4, implement or expand treatment and or recovery support services for this high-risk population. Applications must be submitted through OAA's grants portal on or before April 1, 2025, and follow a set of step-by-step instructions for the application to be considered. Who is eligible to apply? So the OAA has identified a list of cities and counties according to data provided to OAA by the Virginia Department of Health that have experienced a disproportionately high increase in opioid overdose deaths among Black individuals from 2019 to 2023. Eligible cities and counties must meet the following criteria: a 100% or higher increase in Black opioid overdose deaths per 100,000 population from 2019 to 2023, and at least 20 opioid overdose fatalities within the time frame. You can see the cities and counties that are identified here in the charts of those were the ones that would be eligible to apply for this special grant opportunity. And additionally, there's a recommendation for kind of the holistic approach to the process. The OAA recommends each city and county form an advisory group for the Operation Stop project, including representatives from partnering community-based organizations, individuals with lived experience of opioid use disorder, faith-based organizations, local health department, health district representatives, emergency medical service providers serving the community, business community representatives, and representatives from local post-secondary institutions who could provide technical assistance. Any questions on the Operation Stop grant opportunity? Right. And I'm sure that concludes my operational update.
All right, now we've reached the item on our agenda for our public comment. We do request that anybody asking to speak will keep comments to 3 minutes or less. If you would like to speak, please go ahead and hit your raise hand button icon on your Zoom screen there, and our staff moderator will acknowledge you and enable you to speak.
A question from Mike. Mike, I have unmuted you.
Can you hear me?
Yep.
All right, thank you so much. Where's my camera doesn't. All right. Well, thank you, honorable members of the Opioid Abatement Grants Subcommittee and members of the Opioid Abatement Authority, and then those of you in public as well. My name's Mike Fatula, and I am the Opioid Response Coordinator for the City of Richmond. And I just want, and I put this in a kind of a chat question, but I want to say it out loud. I want to acknowledge the Opioid Abatement Authority for making this move with Operation Stop, using data to identify who's at the highest risk right now of a fatal overdose. We've seen the data has come out all over the country, and I think Georgetown just did the O'Neill Institute just wrote a report on this, where the fatal overdoses are decreasing, but the rates among middle-aged Black men are increasing, and that's very apparent here in the city of Richmond as well. So I just want to commend you and acknowledge you for identifying this public health crisis right now using the data, and also giving us localities the opportunity, us 7 localities, the opportunity to apply for funds for this like specific purpose. So I really appreciate that. It's in line definitely with our strategic plan here in the city of Richmond to address the opioid crisis, and we're just thankful for this opportunity to apply for funds for the next fiscal year. So thank you so much.
Thank you for your comment. We're really looking forward to seeing what you do and the other cities, counties do as well. It's going to be exciting to watch this money go to great use and save the lives of the special population. So thank you for your comment. Anyone else? I don't believe we have anybody else who has raised their hand to speak, so we will go ahead and move on to the next item in our agenda, which will be our new business. Under our new business, the first item for the Grants Committee to consider are the recommended amendments to existing state agency awards as described by Mr. Linekum during his presentation, and they are also in attachment A that was with the agenda. So now I will entertain a motion to approve the recommended amendments to existing state agency awards consistent with our staff recommendations as described during the presentation. Do I hear a motion?
So moved.
Thank you, Mr. Spencer. Do I have a second?
A second.
Thank you, Dr. Thompson. All in favor from the committee, in favor of this motion, please say aye.
Aye.
Any opposed, please say nay. Okay, sounds like we are unanimous. So thank you for that approval. Going on to item 5B in our new business. This will be to consider the recommended amendments to the existing city and county grant awards as described during Mr. Linekum's presentation and documented in attachment B to the agenda. Do I have a motion to approve?
So moved.
Thank you, Senator Pillion. Do I have a second?
Second, please.
Thank you, Mr. Spencer. All in favor of approval of these recommended amendments, please say aye.
Aye.
Any opposed? Okay, thank you. Those have been approved. New business item 5C. So our next item is for us to consider the new individual distribution grant awards to our cities and counties, as described in our presentation in attachment C to the agenda. Do I have an emotion to approve these new individual distribution grant awards?
So moved.
Second. Thank you both again. All in favor of this, please say aye.
Aye.
Any opposed? Okay, we have a unanimous approval. All right, item 5D. This is the consideration of the recommendation to approve our new and exciting grant opportunity, Operation Stop. Do I hear a motion to approve this new individual distribution grant awards?
So moved.
Thank you. Do I have a second?
Second, Jim Holland.
Thank you. Hi, Mr. Holland. All in favor, please say aye.
Aye.
Any in opposition? Okay, that is unanimous as well. Excellent. All right, and now I will entertain any other items of new business or any motion from any members of the Grants Committee. Does anyone have anything that they would like to share or discuss? All right, hearing none. Mr. McDowell, is there anything you needed to share before we move on?
Thank you, Madam Chair. Just to point out that the new awards that the committee just approved, individual awards, total just over $900,000. And you know, we've made so many awards so far that it almost needs to be pointed out that that's a lot of money. So I just want to congratulate the committee for making another round of awards, and we'll definitely be sharing this good news with the recipients in the next couple of days. So thank you.
And just one question, Tony, so that others here, there might be some other localities. If you could name the organization that performs for localities surveys, if you will, to ascertain the needs, what's needed most in a particular region to combat opioid. I know that Henrico County is engaged in services of this organization. If you could name that organization again.
Yes, sir. If I understand your question correctly, the OAA has an agreement with the Wright Center at Virginia Commonwealth University. And the Wright Center is able to provide technical assistance to cities and counties across Virginia. And in fact, have been doing a planning study for Henrico County on the topic of pregnant and parenting women with substance use disorders.
And is that currently part of our toolkit?
The Wright Center is developing a toolkit. They're doing both of those things. The toolkit work is being paid for with a grant from the OAA. The Wright Center is extending services of consulting nature to cities and counties around the state on a fee basis that would be paid by the consulting locality.
And I apologize, Madam Chair. I should have hit my raised hand and been recognized before speaking so rudely.
Oh, no, that's perfectly fine. Thank you for your question. Tony, anything else?
Madam Chair, this is Holland, Jim Holland. I wanted to be noted in the minutes that I recused myself from item 5B, which included Chesterfield County. I serve as its chair of its Board of Supervisors.
Thank you for acknowledging that recusal.
Yes, ma'am.
We'll note that in the minutes.
Thank you.
And nothing further, Madam Chair.
Senator Pillion, any closing comments from you?
No, ma'am.
All right. Thank you so much to our awesome staff for all the hard work you've done. And thank you to this committee for your work as well. This has been a great meeting. It's exciting to see the new projects going forward, and we can't wait to see the results, and just very appreciative of all of you. So we have come to the final agenda item today, and that is to adjourn. Do I hear a motion to adjourn?
So moved.
Second. Jim
I
Hall.
think I had a first and a second. Thank you. I'm sure we're all in favor. Everybody have a great weekend. I look forward to seeing you at our next meeting.
Thank
Thank
you.
you.
Bye-bye.
Bye-bye.